The best way to fast for good gut health has become a very controversial topic. It is fraught with conflicting expert opinions. And understandably so, because all human bodies are different. In this short video, we'll discuss metabolic syndrome and the science behind fasting. We'll explore how fasting is different for men and women due to factors like size, hormones, and metabolism. And later, I'll share how to structure an optimal fast, even if you're having trouble regulating your blood sugar. Fasting has become increasingly popular in recent years, and for good reason. Fasting is an effective way to improve your gut health and promote overall wellness. It can help reduce inflammation, increase your energy, and improve your digestion. Fasting can be a way to safely reduce your calorie intake, lose weight, and improve your metabolic health. Metabolic health has been defined by clinicians as meeting certain standards for 5 markers. 1. Waist circumference. 2. Triglycerides. 3. HDL cholesterol. 4. Blood pressure. 5. Blood sugar. In contrast, metabolic syndrome is diagnosed when a patient has any 3 of these 5. 1. Waist measurement over 40 inches for men and over 35 inches for women. 2. Triglycerides over 150. 3. Out of range HDL cholesterol. 4. Fasting glucose over 100. Or 5. Blood pressure greater than 130 over 85. 3 of these, together, indicate increased risk for developing cardiovascular disease, insulin resistance, diabetes, or neurological complications. Fasting can also help to detoxify the body, reduce the levels of toxins in your digestive system, and reduce the risk of developing leaky gut syndrome. When done correctly, fasting can be a powerful tool to help heal the gut and restore balance to your digestive system. You can follow a fasting protocol as a short-term or as a long-term technique. In a nutshell, here is how you can start fasting right away, at any time. Intermittent fasting involves alternating periods of eating and not eating for a certain amount of time during the day. For a successful gut health fast, follow a few simple guidelines. 1. Hours. Start by setting a specific time frame for fasting. You might start with a 12-hour window when you do not eat, such as 8 p.m. to 8 a.m. 2. Last daily meal. During your last meal of the day, eat a solid portion of protein plus fibrous vegetables. 3. Eating before sleep. Avoid eating for 2 hours before bed. 4. Fasting window. As your body adjusts to this new routine, try gradually expanding the fasting window to 16 hours. 5. Optionally, some people like to give the gut a rest by fasting for 1 entire day each week. 6. Hydrate. Whichever fasting schedule you adopt, be sure to drink plenty of water during the day. 7. Avoid all processed foods and sugar-laden foods. 8. Foods. Be sure to eat an array of colorful, nutrient-rich, organic fruits and vegetables that include plenty of fiber. 9. Sleep. Make sure you get plenty of restorative sleep so that your body recovers and repairs. By following these guidelines, you will start a fasting experience that can vastly improve your gut health. Let's dive into the benefits of intermittent fasting to regulate blood sugar. Type 2 diabetes in the US is increasing at an alarming rate. Patients usually experience dramatic increases in blood sugar, which can be dangerous, and in extreme cases, can even cause death. Intermittent fasting has been studied in many clinical research settings, with controlled trials, to test different fasting regimes. These include alternate-day fasting and time-restricted fasting. Exciting results show that therapeutic fasting is successful in reversing insulin resistance. After only 8 weeks, participants in clinical trials have successfully discontinued insulin medication while maintaining healthy blood sugar levels. Other positive outcomes include lower inflammation markers and lower levels of A1C, which is a common diabetes marker. Alternate-day fasting has also been tested in clinical studies, usually involving 1 day of fasting followed by 1 day of calorie-restricted eating. Patients were limited to about 840 calories on their eating day. This pattern could be followed for a few days, up to a few months. In that time, patients were able to regulate their weight and their blood sugar. Published clinical study data, reported in multiple controlled trials, proves that these techniques successfully manage type 2 diabetes. Fasting is shown to reduce the burden on the pancreas, as well as improve blood sugar levels, lipids, and even mental health. If you like this info, please help others by hitting like and share. And subscribe to get the next video in this series. You'll get a better understanding of exactly how to feed your good gut bacteria, and tips to boost your mood and your energy. Do you have any tips dealing with blood sugar naturally? Or tips for fasting? Comment below with your hacks or questions. And suggest other topics you'd like to see in future videos. We read all your comments. Safercures is your source for more natural, science-backed health solutions.